Good morning and welcome to Hot Seat. My guest is Representative Marcus McEntire. Nobody's worked harder on public health issues than you over the past decade. Good to have you.
Thank you for having me. I appreciate it.
For those of us who've worked in public health, we've been wanting for years to have everything data-driven, make sure that physicians and providers could share data. But recently we've seen a kerfuffle break out about behavioral health and records. And I sense that some of this could be confusion, so invited you here to try to clear this up and talk about what's going on. Thanks for being with us.
Oh, you're more than welcome, and I'm really happy that you brought me on to attempt to at least clear this up.
Got it, because when it comes to health issues in Oklahoma, confusion it happens, right?
It does.
And as we saw during COVID, not only confusion but misinformation. And when we're talking about behavioral health, some people have become very concerned about their data, their privacy. But let's start at the 10,000 foot level. You've been working this for years. Help us understand what the confusion is about.
So what the confusion is about, over the past two cycles that we've had, we passed Shine, which created the statewide health information exchange that I'll be referring to as an HIE most of the time. And then last year we passed another bill that mandated its use. But what's important, what I think is mostly significant about that bill is that the legislature would not allow the state to have control of that data. And so the state has chosen a state designated entity in a company called MyHealth. It's an Oklahoma-based company out of Tulsa. They've been in business for 13 years. That whole network was created by health providers. The governance guarding or safeguarding mental health care, that was developed by mental health providers. And so this is a process that's already being used in the state. About 3/4 of the hospitals are on it. We are just extending it out to rural Oklahoma. And because we need to be able to make data-driven decisions. And we also need to make healthcare a little more convenient for our citizens. I mean, there's nothing worse than lugging your medical records around from doctor to doctor. This allows doctors to share information, and the Oklahoma citizen, the patient, is in 100% control of their data.
It's an important point.
Yes.
Because I've seen people say, we're going to have our records going to be out there. The records are private and the patients control it. Is that true?
Yes. I mean, a patient can opt out of these records at any time. There's already governance in place for that existing within MyHealth, the HIE. And so, yeah, if they say, look, I don't want to be part of this process, I don't want my medical records there, they are wiped away. And now you'll have to lug your doctor's records from doctor to doctor if you need to, but your records will be expunged.
You're not concerned about patient records winding up being the privacy being violated? No,
I mean, okay, so this thing is pretty, I mean, I wouldn't say it's locked tight. There's nothing locked down tight. It's nothing that is probably impenetrable, but it has the highest encryption you can have. If somebody not in your care provider group accesses your record, that is audited in real time and flagged, and that will be investigated. So, I mean, I've heard people say that, I don't want maybe my ex-husband or ex-wife is a physician, and I may be going to counseling, and I don't want my ex-spouse to be able to see my records. Well, they can't. And we can go into that further about what is legal to upload to the HIE and all of that as regards to mental health data.
Let's do that right now. So that's part of the confusion or purposeful misinformation. What's going on there?
So I think there's there was some misinformation. I mean, federal regulations say in Section 42, Part 2, I believe, that no mental health notes from the psychiatrist or the counselor may be uploaded. It is illegal to do that. That was never the intent of the Healthcare Authority rules or this policy in general. So that kind of information in the mental health sphere is not uploaded. People's private thoughts, their private problems, all of that is off. That cannot be sent to the HIE. That
okay,
is
so all
illegal
this
to
we've heard about privacy, it's just not true.
Yeah, nobody's secrets are going to be revealed. That data will not even be uploaded. Now, there is some sensitive data that may be a diagnosis or something like that, and that is 100% up to the patient whether they want that posted to their medical record.
Now, are we talking about the opt-in, opt-out phraseology we're hearing about?
Yeah,
what does that mean?
It's kind of unique on mental health issues. It is an opt-in. It really is for the client. It is an opt-in. They have 100% control of what data their provider, their mental health provider, puts in the HIE. If the patient doesn't want their data to go in, they just simply say, I don't want it. Now they're probably going to have to sign a piece of paper saying, I want to opt out of this. And if they do, that will opt them out of the HIE.
Also, I was seeing some concern about the cost to providers. So there's a big entry fee. What is the situation there?
So we're talking high quality data feeds here, with all the security and all that involved. That takes anywhere from 40 to 80 hours of computer programming time with a computer engineer. And that $5,000 is basically just labor. Now, I have proposed a $30 million fund at the Healthcare Authority to help providers with this cost. Because we realized when Senator McCourtney and I passed this, we knew it was going to be a mandate. We knew that some providers would not be happy with us. But we didn't realize that we would also be sitting on a lot of money at the Healthcare Authority that we could easily move over there. So I'm working with the Senate right now on a $30 million package that would cover the cost for these providers, unless they're able to opt out. And we should probably talk about opt-outs as well.
All right, let's do that now. Opt-out, I keep hearing that talked about, but what does that mean?
Yeah, so this is pretty much all providers. So there's a technological opt-out, there's a financial burden opt-out, there is a type of healthcare provider they are, there's opt-outs there, what else? And then there's other things that the state Medicaid director, which his name is Stephen Miller, he works at the Healthcare Authority, he has within his purview to offer exemptions to certain folks. So, for example, if the cost is just too high, maybe you have somebody who is a mental health counselor and they're starting to wind down their practice and they have 5 or 6 clients. Well, obviously that would be a reason to exclude them from this. They simply don't have the revenue to afford it. And so then on the technological side, and this is one thing I think is really important, if you don't have the technology to support transmitting data to the HIE, then you're exempt. So in other words, if you're a provider that doesn't have an electronic health record or electronic medical record, then you will be exempt because that is a technological exemption. And most counselors that I've spoken to do not have an EHR or an EMR, the electronic medical record. That's a pivotal piece. You have to have that to be able to transmit data to the HIE. If you don't have it, you're out. And there's a form that you can fill out on OHCA's website. If it's not there now, it will be shortly, where they can fill that out and opt out of the HIE. Other providers, maybe occupational therapists, speech therapists, where the things that they're dealing with may or may not impact health, and maybe another doctor may not need to know that information. So we have opt-out provisions for size and type of provider as well.
To wrap things up, give me a moment to talk to people about those who may have been confused or still are confused and may have heard information that's just simply not true. What sort of relief can you give to folks about how you're going to try to get this behind you?
Yeah, we're listening. We are. We're listening. Mainly most of the problems are coming from the mental health side of this because they're very concerned, and rightly so. But we're listening, and we will adjust the rules as we need to make sure everybody is comfortable with this. But I promise there are no monsters under the bed on this thing.
I should point out and props to Senator McCourtney because you've been working on this for a very long time.
Yes.
Representative Marcus McEntire, thanks for all your work on this. I know we have so many challenges in Oklahoma, and when one of these speed bumps come along, it's difficult to help folks, but thanks for all you're doing.
Thank you. I appreciate that.
Thanks for watching Hot Seat. See this again at news9.com/YourVoteCounts, and follow me on Twitter, Facebook, and LinkedIn. They're all at Mitchell Talks.